The NCLEX 2023 test plan focuses on assessing entry-level nurse safety and competence. It is structured around 4 client needs and cross-cutting concepts. This plan is effective from April 2023 to March 2026, ensuring a standardized approach to evaluating nursing professionals. The Safe and Effective Care Environment category ensures the safety and coordination of care. It includes subcategories such as management of care and safety or infection control, emphasizing the importance of maintaining a secure healthcare setting. Management of care, comprising 17 to 23% of the NCLEX, focuses on prioritization, delegation, informed consent, and ethics. An example scenario involves prioritizing a patient with chest pain among 4 patients, highlighting critical decision-making skills. Safety and infection control, accounting for 9 to 15% of the NCLEX, emphasizes standard and transmission precautions and hazard handling. For instance, a TB patient requires an N95 mask and a negative pressure room, illustrating infection control measures. Health promotion and maintenance, covering 6-12% of the NCLEX, focuses on growth, development, screenings, and immunizations. An example is the 2-month vaccine schedule, including DTaP, Hib, and IPV, underscoring preventive healthcare. Prenatal and preventive teaching involves educating pregnant women to avoid soft cheeses to prevent listeria. This category includes lifestyle education, emphasizing the importance of preventive measures during pregnancy. Psychosocial integrity, representing 6 to 12% of the NCLEX, focuses on mental health, coping, and therapeutic communication. For example, when a patient expresses hopelessness, the nurse should respond with "tell me more," fostering open communication. Physiological integrity is the largest NCLEX category, encompassing basic care, pharmacology, risk reduction, and adaptation. It ensures comprehensive coverage of essential nursing skills and knowledge. Basic care and comfort, comprising 6-12% of the NCLEX, focuses on activities of daily living, rest, and mobility. An example is managing a stroke patient with dysphagia by positioning them upright with thickened liquids. Pharmacological and parenteral therapies, accounting for 12 to 18% of the NCLEX, emphasizes medication administration, IVs, and blood. For instance, monitoring potassium levels when administering furosemide to prevent hypokalemia. Reduction of risk potential, covering 9 to 15% of the NCLEX, focuses on preventing complications and monitoring labs and tests. An example is monitoring for stridor after a thyroidectomy and airway emergency. Physiological adaptation, representing 11 to 17% of the NCLEX, focuses on emergencies, organ failure, and fluid electrolyte imbalance. For example, managing DKA involves IV insulin, fluids, and monitoring potassium levels. Cross-cutting concepts are integrated into all NCLEX questions, including the nursing process, AAPIE, clinical judgment model, CJMM, and elements like communication, caring, and ethics, ensuring a holistic approach to nursing. The nursing process, AAPIE, involves assessing, analyzing, planning, implementing, and evaluating. This process is consistently applied in NCLEX decision-making, ensuring a structured approach to patient care. The clinical judgment model includes steps like recognizing cues, analyzing, prioritizing, acting, and evaluating. It forms the basis of the next-generation NCLEX, NGN, emphasizing critical thinking and decision-making. The next-generation NCLEX, NGN, features case studies, bow tie items, and matrix C-grid questions. It emphasizes real-world nursing judgment, preparing candidates for practical clinical scenarios. An NGN example involves a post-op patient with a fever. The task is to select priority cues, identify risks, and decide on interventions, demonstrating the application of clinical judgment in complex situations. The test plan timeline outlines the 2023-2026 test plan, effective from April 1, 2023 to March 31, 2026. The next plan will be released in early 2026, effective from April 1, 2026, ensuring continuous updates. In summary, the NCLEX focuses on thinking like a nurse rather than memorizing. It emphasizes safe prioritization, action, and evaluation, with clinical judgment being a key component of the examination process. In closing, the NCLEX 2023-2026 is clear, structured, and evidence-based. Candidates should be prepared for NGN-style questions, with the next update scheduled for April 2026, ensuring ongoing relevance and rigor.